Washing Tech.
If you think about integrating a supply chain piece of data and a quality piece of data, you can think about looking at the cost of a procedure, a standard way to provide a procedure, say a knee or hip, and then you can tie that into clinical outcomes.
Welcome to the Washing Tech Policy Podcast. We deliver the latest tech policy news and brightest tech policy experts to you, wherever you are, so you can stay productive, relevant, and informed in less time. From Washington, D.C., it's the Washing Tech Policy Podcast with Joe Miller.
The FTC fines Facebook $5 billion. Many say it's not enough. Trump goes on a racist tirade on Twitter. And Michael Alkire is my guest today. Hey everybody, the Federal Trade Commission has fined Facebook some $5 billion, with many saying it's a slap on the wrist. One commentator on Twitter called it a parking ticket, although it was a record fine. But the New York Times notes that the fine concludes just one of several investigations currently pending around the world against Facebook. Facebook's revenue last year was $56 billion. You already know about Trump's racist tweets over the weekend in which he told Democratic progressive congresswomen of color, obviously including Representative Ilhan Omar, who fled to the U.S. from Somalia, to, quote, go back and help fix the totally broken and crime-infested places from which they came. Of course, the other congresswomen to whom he was clearly referring, including New York Representative Alexandria Ocasio-Cortez, were born in the U.S., But Brian Stelter from CNN pointed out something interesting. Media outlets like Fox News are avoiding calling the president's tweets racist and instead relying on third-party commentators to do the dirty work. Twitter even said that the president's tweets didn't violate its policies. Twitter, though, is in a difficult predicament since it's currently under fire by Trump, along with several other tech companies for allegedly having an anti-conservative bias. The Trump administration held a social media summit with conservative content creators and politicians last week. The president told those in attendance that he would invite tech companies to the White House to explain their alleged anti-conservative bias. But the president didn't provide any evidence of said bias. The Wall Street Journal reports that Huawei, the China-based company that's been besieged by the Trump administration for allegedly sharing the confidential and sensitive information of U.S. companies with the Chinese government, will be laying off as many as 850 people in the U.S. The U.S. Commerce Department has blacklisted Huawei, which Huawei estimates will cost it some $30 billion. Andrew Liptak reported in The Verge that the U.S. government is planning to test armed robotic vehicles beginning next year. The Army will conduct the live fire tests in Colorado and Europe, and the vehicles will be remote controlled. Scientists at the University of Glasgow photographed for the very first time two photons interacting and sharing physical states for a brief moment. What does that mean? Well, the photograph will advance the field of quantum mechanics because it proves that photons physically interact with one another, something that was theoretical before. Also, the process of taking the photograph was very involved, creating a model that scientists can use to capture other scientific phenomena that are difficult to observe. Finally, Chris Lewis, a 7-year veteran of progressive tech policy think tank and advocacy group Public Knowledge, has succeeded Gene Kimmelman as president and CEO. Previously, Chris was a staffer in the late Ted Kennedy's office. Events. Today, Tuesday, July 16th, the House Commerce Committee is having a hearing on our wireless future, building a comprehensive approach to spectrum policy. That's 10:30 a.m. in Rayburn 2322. The New America Foundation is having an event from 3 to 4:30. Also today, Tuesday, paying for our privacy, what online business models should be off limits. That's at New America at 740 15th Street Northwest. Then looking to Thursday, New America is having another event entitled The Future of Free Expression Online in America. That's from 12 to 2 at New America, again, 740 15th Street Northwest. And you can find links to all these stories in the show notes, as well as the events, and in our Twitter feed. And our handle is at WashingTech. Stay with us.
policy is global policy. This is the Washing Tech Policy Podcast, serving the world.
My guest today is Mike Alkire, president of Premier Inc. As president, he oversees Premier's quality, safety, labor, and supply chain technology apps and data-driven collaborative. Alkire also helped pass bipartisan legislation to help address public health and safety issues stemming from a nationwide drug shortage. He recently was named one of the top 25 COOs in healthcare for 2018 by Modern Healthcare. He's won several other awards as well and has more than 20 years of experience in running business operations and business development organizations at Deloitte and Capgemini. He graduated magna cum laude with a Bachelor of Science from Indiana State University and an MBA from Indiana University. Please welcome Michael Alkire. Mike, thanks for joining me.
Thanks, Joe. I'm happy to be here.
So tell us a little bit about Premier.
Premier is an alliance of healthcare systems of actually more than 4,000 healthcare systems in the U.S. and about 165,000 other non-acute systems that we provide a bunch of services to. So think of things like group purchasing, data and analytics, performance improvement concepts and collaborations. We help both healthcare systems and the other 165,000 points of care to actually be more proficient at providing care and doing it at the lowest cost and with the highest quality.
And I know Premier houses a lot of big data, which can be useful if we properly analyze it. So how does Premier analyze it so its members can use it to its fullest? Do you have any specific examples?
First of all, we have a couple of very unique applications that create these data sets. So we have applications that help our healthcare systems perform from a quality standpoint, and we get the data associated with the quality outcomes. We have applications that help our healthcare systems from a safety standpoint, so we bring that safety data in. We have applications that help our healthcare systems with measuring and benchmarking their labor costs. So we have data associated with that. And then last but not least, we have applications that support our healthcare system's supply chain. And so we bring in all the data from all of the supply chain. And so what we've been focused on is really to integrate all those data to create meaningful insights for our healthcare system. So if you think about integrating a supply chain piece of data and a quality piece of data, you can think about looking at the cost of a procedure, a standard way to provide a procedure, say a knee or hip, and then you can tie that into clinical outcomes. So think of, personal health status things like, are you able to get back to running a mile? Can you go back to work? Degree of mobility of the joint that was replaced and those kinds of things. So we have all that quality data that we can tie into the cost data to give both the clinicians as well as the patients a better perspective of how the care is being provided.
That's fantastic. I'm just here worrying about podcast downloads. But where do you see this? Where do you see the future of tech and healthcare going? And what is Premier doing to be on the forefront of this?
Yeah, so I think healthcare is, because of all this data, we want to use the data to actually figure out ways to provide precise medicine. So that means if you come into the healthcare system and you've had screens or you've done some genetic testing, we want to be able to ensure that the appropriate care is being provided to you. So where I think healthcare is going is looking at all that data and then providing you sort of a cookbook, if you will, of how to care for you from a personal standpoint, depending on what your genetic makeup is, depending on what your vital signs say, depending on how you can metabolize a drug. So we want to get as very precise depending on how you as an individual need to be treated.
Interesting. So if I have a current DNA test, is that something that Premier would access from, say 23andMe or Legacy or one of the platforms, or would that have to be a separate data test that you'd have to consent directly with Premier for?
Great question. So we've got a little micro investment in a company called Prognos. And Prognos is a bunch of data scientists, both out of the Inova Health System as well as out of the academic setting in Harvard. And so what we do, to answer your question specifically, is they have a number of specific labs that you would go and get your genetic markers determined or genetic makeup determined. And then from there, what they're working on is to build out sort of the protocols, if you will, of how to care for patients depending on what their genetic makeup is, and if they come to a healthcare setting with a specific disease or have need of the health system in some way, given that they have this amount of intelligence, they're able to determine what are the appropriate therapies a little bit more effectively as opposed to if they didn't have that information.
So what program or partnership, Mike, are you most excited about happening right now at Premier?
We just launched an entity called Contigo Health. And Contigo Health's primary focus is really to help tie the employers in the U.S. to the providers of care in the U.S. So, a number of very large employers are obviously going through traditional mechanisms to get health care provided for their employees. What Contigo Health is allowing for is for new models, transformational models of how an employer can go get care directly from a provider, both from a national standpoint as well as locally.
And I know Premier recently launched a maternal health program.
Yes.
How will this program help mothers and their new babies?
Yeah, so what our program's really focused on is how can we standardize the whole process of delivering babies, as there is significant disparity that obviously occurs across the U.S. More than 60% of pregnancy-related deaths in the U.S. are preventable. Premier Solutions have helped our members improve the quality and cost of perinatal care for years, reducing maternal harm by 20%, birth trauma by 15.7%, and maternal and neonatal deaths by 20%. So we've got these collaboratives where we are sharing best practices to actually create standards of how care should be provisioned and provided all along the pregnancy.
So the healthcare space is just full of companies claiming to, have the solution or advanced care. What makes Premier different, and how does Premier actually help create change?
Yeah, so I think three things. So first, Premier has a robust data set that actually we leverage to help our healthcare systems improve quality and safety, and then migrate to new healthcare delivery models. So that's number one. Number two, we have collaboratives and services that we wrap around the data that actually support the change that's necessary or going to be required by the healthcare systems along the line of transformation. And then three, our most recent acquisition of Stanson Health, which for the most part takes all this analytics, all this insights and intelligence that we get from the data, and it actually writes it into the workflow so that the provider and the patient have the most exceptional experience possible as healthcare is being provided.
Now let's turn to your icebreaker, your career hack, and your pick for our book this week. So what drove you to want to work in the healthcare space?
So I have a little bit of a longer story, but I grew up in northeastern Ohio. I went to school in Terre Haute, Indiana, and in Terre Haute, I was able to see some of the pretty significant disparities that occur in how healthcare is being provided, and I think I became very impassioned around, how can we, take the best medicine that's being practiced in New York City or being practiced in Dallas, and have that medicine being practiced the same way in a rural community like Terre Haute. And so, it's basically all along the lines of standards of care. It's along the lines of ensuring that the best therapies are at the disposal of the providers in the market. And then secondarily, there's other, potential disparities that occur in those kind of medium and smaller markets, and that's all about getting access to drug trials. So if you happen to reside in an area where you've got a major academic institution near you or a major oncology healthcare system near you, the probability of you getting access to trials is a lot higher than if you happen to be in the in the middle of the U.S. And so our focus is to eliminate those disparities that actually exist, and give people the same opportunity to get access to some of those life-changing trials, no matter where you live.
Mentees. A mentee comes to your office looking for career advice. What's sort of the key piece of advice you would tell your mentees?
Oh my gosh, I hope this is relevant, and I hope it's not too cliche.
Well, as long as it's career advice, we'll be fine.
All right, good, thank you. I always tell people to lead by two words, and those two words are humility and courage. So be humble in the way that you act around your fellow workers and your leaders and the people that work for you, but have that degree of humility. And then I always also say, but do it with a high degree of courage. So take chances, be innovative, step outside of your comfort zone, outside of your boundaries. And I believe, at least for me, it gives you the best opportunity to continue your own personal career growth.
I think that's fantastic advice. Oftentimes we think that we have to hit the ground running, which in many ways we do, but that doesn't mean you have to be a jerk. There's an old book called The No Something Something Rule that came out several years ago that I still remember, that you definitely want to be someone who's not just a great worker, but someone who's actually cool to spend time around and someone that they can learn from.
Well, it's interesting, and I'll have to add one other thing. So I did go to my daughter's commencement speech, and one of the people one of the priests actually out of the Vatican came and spoke, and he was head of communications. And he said, live your life by sort of these three credo. One, that there is not heaven on earth, meaning that, living on earth requires a lot of challenges. Nothing is perfect, but just continue to evolve, the humanness of society, and keep thinking positive change, as opposed to always pulling back and saying, well, things aren't perfect. So that was number one. Number two, he said, you're not God. So, and there's a number of things around, that quote, but a couple of examples he used was, you don't have all the answers. And secondarily, you're not going to be able to help everybody. You're not a deity. You are a human. So do the best that you can do. And three, and this is what keyed it off when you made the comment about being a jerk. He said, "Don't be a jerk. Be nice to your fellow man." And I thought those are three pretty good examples to live by.
Sometimes it's tough, Mike, because these people test my patience. But
Exactly.
you got to keep smiling. But tell us about a book you're reading these days.
So I was a competitive swimmer. I swam in college, and my brother actually suggested this book this last week. It's called The Last Gold, and I don't know if you paid much attention or remember this, but it was all about the East German doping scandal. And specifically for women swimming, and that there were many Americans who, Shirley Babishoff's name comes to mind, but who were the the best swimmers in the world, and because of the doping scandal and all the things that they did from a standpoint of what you would articulate as cheating, these people never recognized their end goal, which was winning an Olympic gold medal.
Well, thanks again, Mike, for joining me. Do you have any final ideas you'd like to leave with the audience before we close? And where can we find you online?
Yeah, so I really appreciate the opportunity, to spend on your program today. I think if there's one thing that the message that I'd like to leave with you is that, Premier has this very, very strong history of helping our healthcare systems improve from a clinical standpoint and a safety standpoint, reducing cost. And it's really been about identifying those opportunities for improvement. And I think the next big shift are the solutions and the services that we're providing that are actually taking all of those insights and writing those into the workflow, which is really significantly changing the way that care is actually being provided. You can find me at Alkire Premier.
And you've been listening to Mike Alkire, president of Premier Inc., transforming health together. Mr. Alkire, thanks for joining me.
Thank you.
And that concludes episode 193 of the podcast. Thanks so much for listening. It's good to be back. You didn't think I was deserting you, did you? I just needed some decompression time. I have another vacay coming up in August, but don't worry. I'm not going any place, at least not anytime soon. Summer really is the perfect time to recalibrate, so I'll be taking off in a couple weeks as well. But I'll be back here for you after that additional break. Lots of issues here at the intersection of tech and healthcare. It's good to see Premier leading the charge on making healthcare more affordable and its most recent foray into maternal health. Looking forward to seeing more from Mike Alkire and Premier. As always, if you like what we do, we'd love to hear from you. Please take a moment, head over to iTunes. iTunes, yeah. No one knows what to call it now. Apple Podcasts, give it a review. It helps others know what they can expect from the show. And by the way, you can give it a review on whatever podcast app you listen to. Do it now. Leave a nice review for us, will you? Thanks again for listening. I'll see you back here next week. Take care.
Washing Tech.